The outcome of patients with myelodysplastic syndromes is very heterogeneous. This mean is very different. We have some patients who can survive for years while others die within a few months. So identifying the right prognosis for the patients is very important from the patient standpoint because it helps them understand their disease trajectory and set up expectations early in their disease. From the treating physicians is also very important because all our treatment guidelines and census are based on risk. So we have different treatment algorithms for patients with a higher risk compared to patients with lower risk. So accurately predicting the outcome is very important because if we're underestimating or overestimating the risk, we're over-treating or under-treating the patients. So we thought, can we develop a model that can take clinical and genomic data using machine learning and artificial intelligence to try to provide a personalized prediction that is specific for a given patient. So in order to do that, we took clinical and mutational data from a patient cohort that we treated at Cleveland Clinic, and we combined it with a cohort from Munich Leukemia Laboratory. That's formed the training cohort, and we validated our model in an independent cohort from Moffitt Cancer Center. So what we did, we took this clinical and mutational variable, we entered them into machine learning algorithm, and everybody talk about machine learning can be a black box, we don't know what's going on, but we have several techniques that we can extract important variables that impacted the algorithm outcome. And then we focus on these variables and we finally build the model. Now, after we build the model, there is no way for us to use it in the clinic, so we built a web application where the user, which is a physician in this case, can put the clinical variables and mutational data, and the output of the model will be a survival curve that is specific for a patient, as well as survival probability at different time point and the risk of leukemia transformation at different time point. Now, when we look at the accuracy of this model and compare it to what current established models like the IPSS or the International Prognostic Scoring System and the revised version of the IPSS or the IPSSR, the model outperformed these. The new model outperformed these models in terms of the accuracy of predicting overall survival as well as the risk of transformation to acute myeloid leukemia. So we believe that this project can be a unique project for two reasons. Number one, we have introduced a new concept of personalized prediction. Now, we always talk about personalized treatment, but I think moving forward, we really need to think about personalized prediction and personalized diagnosis. And also, in this project, we harnessed the power of our artificial intelligence and machine learning to help us to build a model that we can use in the clinic.